Colon cancer is one of the leading causes of cancer deaths in our country. And the vast majority is found in people over 50, and it's considered pretty rare in younger people. But now a new study from the American Cancer Society is showing a drastic change. They estimate more than 13,000 new cases of colon and rectal cancers will be diagnosed in Americans under 50 this year. So to help us put this new study in focus, we're joined now by Dr. Robert Donegan, a medical oncologist from GBMC. Thanks so much for coming in.
Great to be here. Thanks.
Surprised by the results of the study?
I think so. I think there was good news and surprising news. The good news is that in people over the age of 50, we've seen a very substantial decline in the incidence of colon cancer, and that's very reassuring. And that probably reflects screening and early detection of precancerous polyps through colonoscopy. The surprise was to see the increased incidence in those under the age of 50, generally the population that we don't yet screen.
And so why do you think we're seeing this increase?
Well, that's the great million-dollar question. I don't think we really know yet. I think there's speculation and maybe related to obesity, which is clearly more common in society now than when this study started back in 1974. It may reflect changes in diet, which are not as healthy, that might promote the development of cancer and precancerous polyps. It could be the sedentary lifestyle. Bottom line is we don't know, but all of those are things that are modifiable.
Now, do you see this leading to, I know there's a big issue with women and breast cancer and getting those screenings earlier. Do you think this will result in a need for earlier screenings?
Maybe. I think it's a little bit too early to say. I think the screening bodies are going to need to look at this data very clearly and decide whether it should lower the age. Right now, the starting age, I should say, of colon cancer screening for people at average risk is 50. We generally start it younger in people that are at higher risk, people that have a family history of colon cancer, a known genetic predisposition to colon cancer, things like inflammatory bowel disease. One body actually recommends that colon cancer screening start at the age of 45 in African Americans. So this could change, but I think it's really too early to say.
Any ways that you can lower your risk?
Absolutely. Well, I already talked about a healthier diet.
Okay. And that's with everything, it seems like.
Absolutely, across the board. That's good for the heart, good for the cancers, all the above. So a healthier diet, more active lifestyle, knowing your family history in case you need to be screened earlier, and working up symptoms especially. There's no such thing as normal rectal bleeding. And a lot of the younger people don't think about that because they don't think they're going to get colon cancer. But this is a reminder that, yes, colon cancer does happen in younger individuals. It's not as common as in the older ones, but we shouldn't be ignoring symptoms. Rectal bleeding, as I said, changes in stools, constipation that doesn't get better, diarrhea that doesn't get better.
Well, have they made the screening any better? I know that was a big deal.
Well,
a lot of people didn't want to go for the screening. Have they made that any better?
Yeah, I mean, so we still have the colonoscopy, which is the gold standard. Nobody likes the prep, but I will tell you, having just turned 50, it's not that bad. I will tell you that there are other stool tests that we can do, including a new one that looks for DNA in the test that is relatively easy to do. So I think the screening is getting easier. It's certainly getting better.
Okay, all right.
Yeah.
Dr. Garner, thanks so much for coming in.
You bet. Thanks for having me.
We appreciate it.
Okay.
Let's get back to the big story.